I gave Grand Rounds last week and I want to tell you about it. So Grand Rounds is kind of like a weekly lecture series that's given by department. And even though you can present across departments, I did give mine to the Department of Pediatrics. Last week was Patient Safety Week, and so that was the topic of Grand Rounds. My healthcare institution is a part of the Solutions for Patient Safety Network, and so far it's pretty much focused on inpatient or hospital-based, so things like unplanned extubations or line infections. But that does not pertain very much to what goes on in the outpatient or ambulatory or clinical world. But 70% of pediatric healthcare is delivered in the clinical setting, and so what they're doing is they are expanding that program to also now include clinic. And so we started presenting with what we know so far and kind of what we plan to do in the future. And most research really calls for the need for more research, that we don't understand all of the safety issues that happen in pediatric clinic and that we need to study and learn more about it. And so there's so little research done into it already that I couldn't even tell you what were the most common safety errors or areas of concern as far as patient harm goes in the clinical setting, let alone be able to rank them in order. But I can give you kind of an idea of where the most research has been done. So just like inpatient, falls are also a problem in the outpatient world. Now, when I think of falls, I usually think of three scenarios. I think about babies who accidentally roll off of the exam table. I think about kids who are playing too much and accidentally fall. So think about kids who come to clinic in their footy pajamas or their socked feet and they slip on the floor, or they're playing with the rolly chair in the exam room, or they are climbing on the furniture and they fall. Or I think about the third category after an injection or a blood draw and somebody faints. But it turns out that is not the most common place for people to fall in clinic, according to the research that we have so far. So the most common place for kids to fall in pediatric clinic is in the waiting room, which is so good to know, because if you know that that's where it's happening, then you can do things to specifically target that area of concern. We can make our waiting rooms more safe. We could identify or teach our front office staff to identify people who are at risk for fall so that they can do something about it. Maybe we can bring them back faster, or maybe we can keep an extra eye on them if we identify somebody who is at risk for a fall. And so there has been a tool developed to identify kids who are at risk for fall, specifically in the outpatient setting. And so you kind of get points for age, if you tend to fall a lot at home, or if they have conditions that may set them up to be more likely to fall. And then you can predict their risk for fall. And it turns out the biggest risk factor actually for falling in the exam room is falling in the waiting room. Now, the second big area of concern in outpatient clinic that we know so far are medication errors. Now, the advent of the electronic medical record has really helped a lot for this, because it can do things like calculate a dose for us, and it can run interaction checks with other medicines that the patient is already taking. It can make sure that we're not prescribing a medication that the patient has an allergy to, and that's all done automatically. But we have to make sure that the patient's record is accurate, so we've reconciled their allergies and their medications. And people always cite time and feeling rushed as a reason why they didn't go through all of the steps that we need to, but we find that that's where most of the errors are happening. The last category that I looked at was at diagnostic errors, and actually this is where the electronic medical record really does a disservice to us, where we can go through things too quickly and maybe not get to the right answer that we need to get to. Electronic medical records allows us to do things like click really fast, all normal, and go through the steps really quickly, where it kind of writes the note for us, but we don't take the time to slow down and really think about a case. We also run into more errors when we have tests or diagnostic equipment that doesn't sync automatically with our electronic medical record. So that is a very brief, under 5-minute overview of a lecture that was an hour long that I gave with somebody else. But it's a project that I'm working on and I'm really excited to be a part of, and to increase the safety and decrease patient harm that goes on in our clinics.